Hello friends, welcome to our YouTube channel for nurses preparation. I am Neeraj Kumar Kaithal. Today we are presenting few important NCLEX style questions from cardiovascular system. This video is important for upcoming Aims norcet exam 2021. So everyone, let's begin our today's video. Let's see the question. Client with heart failure suddenly have extreme dyspnea, tachycardia and lung crackles. Nurse suspect the client is having pulmonary edema. Healthcare provider contacted and expected interventions. Select all that may apply. You are a nurse, you are a nursing officer serving in a hospital. You are treating a patient who is diagnosed with the heart failure. Suddenly patient complains he is having difficulty in breathing, dyspnea. You assess his pulse and found its heart rate more than 100 beats per minute. It means he also having tachycardia. When you auscultate the client's lung, you find lung crackle or crackle sound also present. After analyzing these points, you are having the idea that the patient may develop pulmonary edema. Pulmonary edema is also known as wet lungs. This condition is developed due to excess fluid accumulation in the lungs. After this, you just call your nearest staff and said to inform healthcare provider about this situation. You are just waiting about healthcare provider's order. What are the expected interventions may be applied by the healthcare provider to treat this situation? Select all the points that may be helpful to treat this condition. Option A, give oxygen. Option B, insert Foley catheter. Option C, administer furosemide. Option D, administer morphine sulfate intravenously. Option E, transport client to the coronary care unit. Option F, place the client in low Fowler sideline position. This is a very important MCQ. Select all the answers that you can apply in this situation. This is a multiple choice question. Now let's talk about the answer of this question. In this situation, intervention A, B, C and D are the correct and option E and F are not necessary. Heart failure is a condition in which heart fail to supply blood according to the body's demand. In this situation, left side heart failure is seen because in left side heart failure, left ventricle fails to pump sufficient blood, and due to this, the symptoms that patient is facing are mostly related with the lungs. You can see dyspnea, lung crackles, pulmonary edema, all are related with the lungs. So always remember, whenever the left ventricle fails or left side heart failure occurs, lungs get mostly affected. Most of the time all the symptoms related with the lungs. Now let's talk about the rationals. Pulmonary edema is a life-threatening event. Left ventricle failed to pump sufficient blood, so blood accumulation in the lungs occur. Due to this excess fluid or blood accumulation in lungs, patient have dyspnea, difficulty in breathing. To treat this situation, we have to give oxygen and provide Fowler's position to the patient. In the Fowler's position, the head end of the patient, this is the head end of the patient and this is the leg part of the patient. We have to increase the head end of the patient approximately 60 to 90 degree angles. If the healthcare provider orders to give high Fowler's position, so apply this position to the client. Second point, insert the Fowler's catheter. Before inserting the catheter, administer the furosemide. Furosemide is a antidiuretic drug. It is sold in the market with the name of Lasix. When we administer diuretic drug, the patient have excess urine output. To measure this condition, we have to insert Fowler's catheter. Now, morphine sulfate is administered. Morphine sulfate is a opioid analgesic. You know that morphine sulfate is mostly used to treat the severe pain, and it is given in the condition of myocardial infarction also. But in case of pulmonary edema situation, with the order of healthcare provider, we administer morphine sulfate intravenously to reduce the venous return or preload. With the effect of morphine sulfate, patient's anxiety level decreases and work of breathing also decreases. So friends, this was all important about the question. Thanks for watching. All the best.